Hi, my name is Laura. I am in NURS 3320 at Fairmont State University, and today we are going to be doing a focused cardiovascular exam. This is very different from what we will do in the real world. In the real world, a lot of it is very streamlined. You're working as you go, looking at different things. So keep that in mind. And to start, we will do all of our basic nursing interventions. You're going to wash your hands, knock before you enter, provide for privacy, introduce yourself, identify your patient with those two identifiers, and then explain to them what you're going to do and get their permission to do it. A lot of times if you tell them what you're going to do beforehand, they're a lot more cooperative. As you're doing all of that, you should be looking at your patient and looking for different clues. Are they grabbing their chest? Are they breathing very hard? Are they pale? Are they diaphoretic? Are they red? And then after that, you're going to start with a more focused exam. We're going to look at their extremities first. So everything I talk about in this little bit, you're going to do both and their arms and their legs. You're going to look for any bruising, which is ecchymosis, any lesions, any wounds, anything like that. You're going to look at the coloring of their arms. You're going to feel for warmth. Make sure you go all the way down to their fingertips, because sometimes even if they're warm here, they're freezing here. Bruising, ulcerations, any changes in their hair pattern, any changes in their skin texture. Is it dry? Is it flaky? Any of those. You're also going to be assessing their nail beds. You're going to look for shape and angle of their nail beds. You are going to be looking for, in their fingers, again, the color and temperature, and then again, color of their nail beds. You will check for their capillary refill. Again, both of these, hands and feet. Capillary refill, you pinch their fingernail till it blanches, and then count how long it takes for it to turn pink again. It should be less than 3 seconds. Anything greater than 3 seconds, we are looking at a perfusion issue. And then we're also going to look at their pulses. So in the arms, we have a very common radial, which you feel, I always like to think R, thumb, and I kind of just spin my thumb, I don't know, it looks like an R. Feel for the radial pulse, and then their brachial pulse up here. You will do this for about 60 seconds. Each place you do it, count how many times you feel that beat per minute. It gets pretty tricky sometimes if they have a really high heartbeat. You look for rhythm. If it's you want it to be nice, clean beats. Don't want anything thready or irregular. You also want to be looking for the amplitude or the strength of their pulses, which is again anywhere from 0 to 4. But this time 2 is actually our normal. 0 is absent, 1 is weak, 2 is normal, 3 is full, and 4 is our bounding pulse. And then again, we'll do this, all 3 of those assessments, rate, rhythm, and amplitude as we go down through their pulses on their legs. You do femoral, which you find up in their groin area. The popliteal, which you find back behind their knee. The posterior tibial, which you find behind that ankle bone. And then the dorsal pediis pulses, which you find on the tops of their feet. Those sometimes take a minute to find, and if they're hard to find, I suggest marking them if you can. And then we're going to start examining their chest, looking for any contour, any contusions, any lesions, any retractions. We're also going to be listening for their pulses. You can assess for at the point of maximal, the PMI, for their aortic pulse, down in between the 5th and 6th rib. So you'll palpate and feel for that. And then you will also listen at their carotids. Do not do what I did just there and pretend. Do not compress both of them at the same time, because you will cut cut off blood flow to their brain. So we're going to take a listen, and you'll listen for any bruit up in that carotid. There it is. No bruit. Bruit is that very chaotic noise, which we don't want to hear. And then you'll, again, palpate and feel, looking at that rate, amplitude, and pulsation. And then we can also, since we're go ahead and listening, we can listen for the 5 different points. You'll have your, good way to remember is All People Like Times magazine. We have our aortic point at the second intercostal space on the right side of the sternum. You listen here. This is a good place to listen for at least 60 seconds. Then directly across, you have pulmonics. Down to the third, you have the herbs. At the fourth, you have the tricuspid, which is also on the sternal border. And then lastly, which we have at the fifth, but at the mid-clavicular line, you have the mitral. At these spaces, you're going to be listening for those 60 seconds. You're going to be listening for S1 and S2. Those are lub and dub. S1 is lub, S2 is dub. You're going to be listening for any extra sounds. You're going to be listening for rate, rhythm, any of those. Well, also, an important thing to do is we're going to take their blood pressure. You take your cuff. I'm not going to make him unroll his sleeve, but I just did have a patient unroll his sleeve. You make him unroll it. You put it on. You line up artery with that artery in their arm. If you're using a manual cuff like I have, you'll pump it up, and you'll also be listening at that artery point right below it. You'll pump it up, which I'm not going to do right now, and then slowly release it. When you hear that first noise, that is your systolic blood pressure, and when you hear the last, is your diastolic blood pressure. Another important point that we do with the blood pressure is we are going to look at the ankle brachial index. You will take their blood pressure and you take their systolic up at their arm after they've been laying flat for 10 minutes. We got a chair, so we're not going to show that right now. Listen, you're going to take the systolic, that is our bottom of our fraction, and then you'll do this again. You'll take the blood pressure at here and get the systolic while listening at that posterior tibial space. You take your systolic from your ankle over your systolic from your arm. Do it side to side, and then you divide it, and it should be between 1 and 1.4. This gets to be anything above less than 0.9. We're starting to worry about some arterial disease.